Okay. Um, hi everyone, and welcome to Google Hangout, when we're going to be talking to one of our newest guest and case of uses of open data for the purposes of development. I'll let Sam talk a little bit about our guest, Clark. First, just a little bit of background about this project. For the last couple of months, our team from the Open Finances team in the World Bank and the Open Knowledge team from the Inter-American Development Bank, we have been conducting research about the uses of open data in development. We've done a survey where we've captured about 85 cases, and we've released that as open data, so feel free to use it for your own research or your presentations. And pretty soon we're going to be publishing a white paper based on the research and highlighting a few of the cases. Today we have a really exciting case and about the use of open data in tracking health issues, and I'll turn it over to Sam to talk a bit more about it.
Yeah, as Sandra said, we're really excited to have healthmap.org with us this morning. So, to add a little more context, so the outbreak of disease obviously is a huge global concern, as exemplified by Ebola. And, the World Bank has also committed about $400 million to fighting the disease, and estimates that if this disease is not contained, that it could cost about $32.6 billion. So, healthmap.org has been operating of years, but recently it's been getting a lot of attention for having detected Ebola 9 days before the official World Health Organization announcement. So we're interested in HealthMap for that reason, and also because it uses a number of public information sources, media, and also open data sources to provide real-time information about disease based on a number of filters, including location. So welcome, Clark. We're excited to have you this morning. And if we could start by, I guess, if you could provide us a little bit more about your background and a little bit more about HealthMap as well, just to get started.
Great. Thank you very much, Sam and Sandra. My name is Clark Feifeld. I'm a co-founder of HealthMap. I'm a research software developer at Boston Children's Hospital. My background is in computer science and software development. We started HealthMap about 8 years ago now, and the basic idea behind the system is that we have a web crawler that is working around the clock, goes out on the internet to hundreds of thousands of different sources of information. So news media, professional groups, World Health Organization is one of our sources, other government agencies. We pull in all this data from publicly available sources, and then we apply some filtering algorithms, some text processing algorithms, and then we bring all that information to the healthmap.org website, make it all publicly available. We provide a worldwide comprehensive overview of ongoing disease outbreak activity. So that's kind of really the basic concept behind the system.
That's great. In terms of, yeah, I mean, it's really cool, and I've actually signed up for it as well. So I've seen what's kind of breaking in the area, and so getting a first-hand look of that technology and the process has been really enlightening and interesting. So what made you and the team first pursue this idea, and what sort of inspired the spark?
Yeah, great question. So the idea really came from my co-founder, John Brownstein, who is an epidemiologist. And the basic problem that we saw at that time was that really there was a wealth of information out there on the internet about disease outbreaks, and this really kind of near real-time reporting. But the problem is that it really was not well organized. And so that's kind of been our unifying mission around HealthMap, is to take all these sources of outbreak event data from anywhere on the internet in any language, and really try to make that useful to to make it really just easy to browse the data, to view it on a map, to search it, sort in different ways. So that's really the concept there.
So it really sounds like the Google of sort of health information, like trying to organize it, try to give it to people in a way that makes sense, that they can sort of improve their understanding of what's around them, and also better decision making. That sounds really, really awesome.
Yeah, that's not too far off. Actually, Google.org, which is the philanthropic arm of Google, was actually one of the very early funders of the project. After we had created a prototype, they provided some funds to support us to kind of move beyond that stage, and they've been a great partner on the project actually over the years.
So in the process of trying to organize all this information and build out the tools, were there any problems? Were there certain process issues that you had to deal with along the way? And if you could share some of those with us.
Yeah, there are a lot of different challenges that have come up. One of the biggest problems that we grapple with, working with content that really comes in the form of free text. So these sort of news articles that are talking about an outbreak situation, and then we have developed some automated algorithms for processing that, but it's often difficult to tell, say what exact location an outbreak is occurring in just based on the description. Sometimes, an article will just give the name of the town. Let's say San Jose. Well, there are probably a dozen different cities worldwide called San Jose, and a lot of times, the publication won't necessarily say, what province and what country that city is in, and so we've struggled at times with kind of dealing with these different kind of ambiguities that come up in the data. Another issue that we come across is that there's a lot of noise out there. You search for disease-related search terms across these wide range of sources. You're going to get a lot of hits for maybe things that are disease-related but are not related to an outbreak. So like scientific findings or vaccination campaigns, things like that. And then you also get things like an outbreak of home runs in the 7th inning, or things like Justin Bieber fever and things like that.
It's a real disease, right?
We have algorithms for addressing that issue, but there's always sort of noise in the system, and we're always kind of working to try to limit that.
That's so interesting. So would you say, in the 8 years since this has started, obviously the technology has adapted, has evolved, and so has the volume of information on the internet. What do you think has been more useful in delivering healthmap.org? The advances in technology, or sort of the increase in volume of information?
I would say a combination of both. In terms of the technology side, I would say probably the biggest change since we started has been the adoption of mobile devices, smartphones. The iPhone wasn't invented when we launched HealthMap, which is kind of hard to imagine now. But now we do have a mobile app for the site. It's called Outbreaks Near Me. That's available for both iOS and Android. We also have other kinds of mobile spin-off projects that we've done, and that real shift in the technology landscape has also allowed us, I think, better to engage directly with users, and we get some degree of actual direct reports through the mobile apps, where people can, if they see something happening in their community that we're not picking up on HealthMap, and they can report that directly, and it's sort of even more natural to do that with a mobile device, because you're out there in the field. It's very simple and convenient to be able to submit a report. So that's been really a big thing for us. In terms of volume of information, on the other side of that, that's also exploded. Many more news sources are now online. You have also kind of the rise of social media, which again was very, very limited when we started out. And today we have many actual official ministries of health, government agencies that have Twitter and Facebook presence that are making announcements in real time about events that are going on. So we pull data from those. Also just looking at kind of the mass of Twitter data as an indicator of outbreak activity. And those are all really exciting areas of growth for us in the project.
Oh, you have a question, please.
Sorry, I mean, I'm actually really curious about the reaction to Health Map over the past few years from either the healthcare community, from these ministries or organizations like the WHO, whether you've seen, whether there's been any kind of evolution in terms of the reaction to you guys and your work, or any stories that you can share. And then I guess the second question is, how has the data that you collect and organize and synthesized used by other organizations? So I mean, I certainly use it from a single person, individual side, but have you been able to build partnerships and collaborations with other like mass consumers of it?
Yeah, absolutely. Great questions. So on the first one, in terms of the shift in attitudes, yeah, I think there's definitely been a change from when we started. And when we first started out, I think there was a lot of skepticism from the public health community around these concepts, and looking at what they call informal sources, so things that are not validated by an official government agency, and kind of I think there certainly was a lot of interest and excitement around Health Map and systems like it, but also a lot of kind of hesitation about whether it's really a good idea to even look at these sources and whether they have anything to add. And I think that's really kind of changed to 180 degrees in the years since then, and now this is really in terms that this is really important part of public health surveillance, and there's all kinds of other initiatives in this area. Yeah, it's really definitely changed. In terms of collaboration with other groups, yeah, absolutely. We worked with certainly U.S. government agencies, CDC, HHS, USAID, to develop, say, targeted feeds for them, or take our data in terms of a structured feed to allow them to plug that into the systems that they're using, so they can do the data integration on their side and bring together kind of different data sets that they have into a unified visualization. So we definitely do have a lot of those ongoing collaborations.
Are there any public, I guess, outputs of them that we might be surprised are fed by Health Map? That you can share? Maybe it's the top secret.
Yeah, that's a good question. I'm not sure. I know there was a project, the dengue vaccine initiative, that was using a feed from Health Map. I'm not sure if it's still live.
Okay.
Another collaboration is where we also around dengue that we worked on with CDC, is where we had right on the CDC dengue dedicated webpage, there was a direct link to Health Map and to a dedicated Health Map visualization of dengue activity with the CDC's kind of official risk maps also overlaid onto that data, so you could see kind of the background layer of kind of what is the common professional assessment of where are the risk areas for dengue, and then juxtaposed with the real-time data of where are the actual outbreaks happening.
Thanks. And
Yeah.
You had questions. I jumped on. Sorry.
No,
Thank you for that.
That was awesome. In terms of the collection you mentioned earlier with mobile, is that primarily happening in the U.S. or is that happening globally?
Well, I mean, over the years, we've actually, I mean, across all of time, seen actually pretty broad engagement from users around the world. You know, most of our reports do come from the U.S., and they also sort of tend to be more biased towards areas where smartphone adoption is higher. But you know, that does include a pretty good part of the world, and you know, it's a range.
And what sort of traffic are you seeing to the website? So obviously, the smartphone collection would be concentrated in places with higher mobile collection, but in terms of global usage of the site, where are you seeing most of the traffic from?
Oh, so yeah. So where does our traffic come from? Yeah, it's a mix. I mean, we get a good chunk from the U.S. We also get visitors, you know, from Europe and Asia, definitely parts of Africa. As I mentioned, you know, we cover multiple languages, and we also do our best, at least, to also provide parts of the user interface for the website in also several languages as well. So if you're coming from a place where at least one of the languages that we cover actually see the map and all the. But yeah, and then you know, the other thing that visitors, we get a mix of people who are you know, public health professionals, people in government agencies, but also just people from the general public. And that's, you know, a huge number of our visitors are just people that are, you know, not professionals, but that are just interested in this type of information.
Is there anything about what people are doing with the site that surprises you? Obviously, they want to know what's happening around them, but it's something sort of that you couldn't have expected to happen.
Yeah, I don't know. I mean, I guess yeah, I guess, you know, maybe the most surprising thing overall is that this thing really took off the way that it did. You know, when we started it, it was really just a kind of a side project, nights and weekends, and you know, I figured, you know, I would sort of slap it together over a couple of weekends and, you know, put it out there, and then I would just kind of go back to my day job. But, you know, this very quickly became my day job, and, you know, again, it's, you know, I mean, I think it's very interesting, but I think for a lot of people, you know, infectious disease is sort of this niche thing where, you know, yeah, maybe, you know, public health officials are really interested in it, but, you know, are people really excited and kind of engaged around these issues? And we found that, you know, they obviously really are, and that's, you know, that's really exciting. And it's, so, you know, we've really been, I think, sort of surprised at people's response to it and how it's taken off.
Yeah.
Oh, you're covering my questions too.
Oh.
What questions did I have?
So what's next for Health Map? I mean, obviously, the thing has taken off, and it's increasingly there is a lot more, like you were saying, in the medical community. So what's next, and how do you see this taking the next jump?
Well, you know, there are definitely a lot of different areas that we're working on. I think probably the biggest challenge that we're sort of trying to crack right now is this is looking at social media, because there's really a wealth of information there. It's like just say in Twitter in terms of real-time signal, but the problem is there's also a tremendous amount of noise there. You know, really even more noise than you see in the news media and other, you know, the sources that we've been working with for some years now. And so we're still kind of, you know, we have some approaches, and we've been collecting data, but that's still an area where we're really trying to extract something that's a valuable signal that's useful, that we can plug into the site, and that we can kind of really maintain the level of quality and experience that people are used to with the existing Health Map site, by really improve it by bringing in this new data source. So that's one area. I think and other areas are we're always adding new languages. We have 15 languages now, but you can always kind of extend your reach at least a little bit by adding more languages and capturing data really in the original language. Another big area that we're working on is improving our algorithms. Just getting better performance from text matching, better performance for our automated filtering, so that we have less noise, and then that in turn allows us to kind of cast a wider net to kind of bring in more data, because we were better able to filter out the noise that inevitably comes with that.
So I guess the first part, you're essentially trying to find a cure for beaver fever, and I guess we don't have that yet, but you guys are going to work on it. What a follow-up question to that? So, as you've been collecting this information over the last 8 years now, and you obviously store that and you use that to kind of improve your algorithms. Is there any plan to make some portion of this public or even accessible for short periods of time? I mean, this type of information must have enormous value in the public health community.
Yeah, we do allow data export from just directly from the website. I think it's there's some limitations on that, but there's still a lot of data that you can get at there. We typically, do sort of research collaborations with people that contact us, and a lot of people do contact us saying, do you have an API or a data feed, which we do, and we generally just set people up with that. So, I would say for viewers, if you're interested in working with these data, definitely contact us, and we most likely can work out a way to get you the data.
And what would be the best way to contact you?
info@healthmap.org. Sorry.
Okay. And I can guarantee that you'll get at least one data request from 2 people that you're talking to right now.
Okay.
But, no, that's great, and I think you can really see wide application of this type of information, and it actually having like a very positive impact on development and society.
Sorry, it froze up for a minute.
They're just saying that really great that you guys have this and you're open to new partnerships and collaboration, because a lot of times when we think about open data and sort of what matters to people, I mean, health, education, things that actually have a very direct impact on well-being. I mean, you can clearly see applications of this, and I think and I hope that one, that we can collaborate on a few things together, but that others that might find this useful could also reach out, and something would come out of those partnerships.
Yeah, definitely. As I said, we've done a lot of partnerships, and that's very important for us.
I don't really need any questions. I'm really grateful that you took the time to spend with us. And I'm hoping everyone who watches this or catches up, checks out Health Map, and really, it's a great way to educate yourself about what's happening. Thanks to Sam sending me some alerts, I learned about meningitis at Georgetown Hospital. So, it's incredible.
Great. Well, thanks for inviting me.
Thanks, Clark.
Okay. All right, well, thank you to everyone else for, this was, I think, our shortest and most efficient one yet.
Most packed.
Exactly, and feel free to add to the catalog of uses of open data. Yeah, okay, thanks, bye.